Another dangerous trend that's really been popping up on social media. A lot of kids have been posting these videos and pictures. They're calling it do-it-yourself braces.
Putting rubber bands, strings around their teeth to straighten their own teeth so they don't have to get braces. You know, kids, they don't want to wear those braces.
And then plus they're so expensive. So we've brought in a doctor, Dr. Kimberly Christie.
Hi, Doc.
And we also have Bella here. You're 12 years old, right?
Yes.
Yes.
How long have you had those braces on?
Since March 2015.
And a professional did it. You didn't do this thing.
Yes, she did it.
Okay.
Well, Dr. Christie, I mean, essentially, down to like, if you want to get real simple with it, could this work, putting rubber bands on your teeth?
It can work. The problem when you're doing it yourself or at home is the force is not controlled. We also worry about the risk of infections. So there is a potential for it to work, but there is also potential to have serious adverse effects, as serious as losing teeth.
How could you lose your teeth?
The rubber bands that are being used are placed around the teeth, and the teeth are conical or ice cream cone shaped.
Yeah.
And those rubber bands can actually slip underneath the gum tissue, and that can cut off blood supply or damage the bone. And in serious cases, the teeth can actually fall out.
Well, show us on, well, you can either use Bella's real face
So
or your models there.
We do use rubber bands, but we use it in conjunction with braces. And what that allows us to do is to precisely move the teeth.
You want to smile for us, Bella, so we can see your bands
Bella
there?
has rubber bands that are in, but they're attached to the braces themselves, and that helps to fix her bite. We also will use something that's called a chain, which are rubber bands that are connected to each other that will allow us to close space, but we can attach them to the braces.
So like right here?
Exactly, so that they won't slip up and underneath the gum tissue.
So have you heard about this trend, these kids doing it themselves?
I've heard about it from YouTube and reading about it online.
But you haven't had to repair any?
I have not had to repair any.
What were your thoughts when you first saw this?
I was horrified. You know, as an orthodontist, we go to school for an extra 2 to 3 years after dental school to receive training in order to move teeth in a healthy way and into a healthy position.
So what would happen to it? Do they get up underneath the teeth? And
the concern is that the rubber bands.
Could you show us here on the, like on
Yep, so the rubber bands that the kids are using are actually wrapped around the teeth themselves.
Okay, so it's like down here.
Yep, and so that can slip up top and go underneath the gums. And if that happens, then the rubber band can impinge on the bone and on the ligament that connects the tooth to the bone and can cut off the blood supply. And eventually that can cause the bone to deteriorate and can cause the teeth, in severe cases, to actually come out.
Well, bring us up to date. Now let's look at Bella. Oh, look at that smile, baby.
Because even with Bella, she has to come in regularly.
She has to come
like
in
once a month to get her braces and tightened and checked.
Yep, we see her about every 5 to 6 weeks. And one of the things on the internet, they were saying that cost, and so the kids are trying to do it at home to keep the cost down of going to an orthodontist. And one of the important points is to realize that cost can be a concern, but it shouldn't be a barrier to treatment.
A couple things. How do you know that your child needs braces, and how much does it cost in 2015?
Well, you want to see an orthodontist. The age that we recommend is anywhere from 7 to 8 to see if there's a certain problem that needs intervention. And so once it's determined by an orthodontist that your child might need treatment, then the cost really depends, and insurance can be a big factor.
Yeah.
You know, and the orthodontist, you know, there's different payment plans.
Sure.
The other thing that's nice in our area is that we have access to many different universities. And so there's dental clinics. I work with the University of Pennsylvania, and they have an orthodontic clinic that can offer access to care at a lower cost.
Yeah.
Exactly.
Hey, where's your practice?
I'm in media.
Oh, the home sis area.
Exactly.
Exactly.
Yes, we treated her daughter.
Oh, that's great.
Wow, Nia, yes. Who's now off to
Going
college.
to college.
That's
I
right.
know.
Yeah.
I know.
Well, thank you so much then for telling us about this. And Bella, how much longer does Bella have for her braces?
I think she's got about another 1.5 years. If she's good with those rubber bands, it might be a little bit less.
Where do you go
than
to
that.
school, Bella?
I go to Strathaven Middle School.
Cool. Nice to meet you.
You ready to get the
Nice to
braces
meet
off
you.
already?
No.
You like them?
Yeah, I think they're cool.
Hey,
with
you
the
look
colors.
cute.
And the colors, yeah, I love the colors. Purple and green.
Cute.
Thank you so much.
Thank you,
Great
guys.
job.
Thank you.
Are you two related?
No.